مرتين نخلص. دكتور بليز ستارت. بس كده ماشي احمد.
خلي هو اي اس ده كله اي اس اسمه اي اس هلاقيه فوق بس لا اصل انا مش هكتبها كده مش لعيب حرك مصر والسي ده في لا لا مش الشارع اي اس بيلعب الشارع خليته كوبوس اول ما تدوس هنبدا على طول نحط فين عن
Doctors, please start.
أنا فتحت اللايف ده.
هو صح كده صح احمد اللي هيتكلم من الناس على طول بديله
ايه ثواني قبل ما تلعب
ثانية واحدة يا جماعة، عايزة الصورة كاملة. شيلوا لي البارتيسيبنت دول، عايزة الصورة على أحمد بص يا أحمد، بص طلع عامل إزاي. ما أنا مش عايزة.
خلاص انجي اتشالت خلاص.
الصوت من هنا.
Nasr, how are you? Everything is okay?
It's my pleasure to introduce you for this subject. دكتور محي رئيس لجنة الصحة والدواء باتحاد المستثمرين، عضو مجلس إدارة غرفة صناعة الأدوية. الدكتور محي طبعا له باع كبير جدا في صناعة الدواء، وكيل مجلس تصدير الصناعات الطبية، عضو لجنة قطاع التعليم الصيدلي التابع لمجلس أعلى الجامعات، عضو مجلس الشيوخ. له رؤية كبيرة جدا طبعا في تطوير صناعة الدواء على فترة كبيرة، وهو صديق عزيز. فإن شاء الله دكتور محي will talk about strategy of drug industry in view of the Egyptian vision of sustainable development 2030. We will be enjoyed إن شاء الله.
Thank you so much, my dear friend.
Thank you. Please, Dr. Mahdi.
First of all, I'd like to thank you so much, my dear Professor Dr. Abdel Nasser and Dr. Ayman, all of esteemed guests, which I'm really very happy and honored to be joining you with this very important session about the pharmaceutical strategy or the problem that may be facing. Did you hear me?
Yes,
everything's okay?
Well,
Okay, thank you. This hot topic or issue is very important to discuss about it. regarding the Egyptian case or Egyptian situation of the pharmaceutical manufacturing and production of different type of products, including also medical supplies, devices, and appliances. In accordance with the Egyptian vision of sustainable development, unfortunately, the whole plan, to some extent, missing the case of pharmaceutical industry. That's why we try hard to join this vision with our vision in accordance with the Egyptian vision. The pharmaceutical sector in Egypt is one of the most strongest sectors in Egypt, which achieved annually not less than 9 billion Egyptian pounds. This figure actually is encouraging a lot of investors and a lot of investment in this area. Now we reached more than 190 manufacturing facilities in Egypt, and also 260 manufacturing facilities of medical supplies, which actually cover the Egyptian needs, I mean the local needs, more than 90% in value. So that we need actually to stress our strategy and our vision, not only to produce the traditional medicine, which is very important. Of course, I don't mind to do that, and we cover more than 90%. But also we have to have another new look about the most recent medicines, like biological medicines. I mean, the biotechnology products or biotech products, the high-tech products, the anti-cancer drugs, blood derivative products. Actually, we're facing a lot of shortage of these products because all of these products are important actually. And it costs us a lot, maybe more than $2 billion a year to import this advanced products. So we need to highlight the near future about going through the era of the biological medicines. To do that, we have to have a plan. We have to advise the investors in the future how, if they would like to introduce this market, they need actually to invest in this sector. Maybe 1 month ago or a couple of days ago, we hear about the most famous Egypto Pharma company that had been actually introduced to the market, which is actually planned to manufacture of the biological medicine as well as the anti-cancer drugs. And this is one step ahead on the track of biological medicine that we are actually in bad need in Egypt. So this vision should have to have the correlation or the coordination with the university, especially in Shams University. And I have the honor to be a board member of the Faculty of Pharmacy of Ain Shams University. We have to have this cooperation with the university. Long period ago, we don't actually have the strong relationship between the industry and the university. That's why it put us in I don't like to say the critical situation, but we have to join us and join each other just to make this modernization of the industry. And I do believe that at the Supreme Council, at the educational sector, we try hard to produce this type of cooperation or coordination between the industry and the university through a new company we actually suggested to have it, which called a company of research management, not producing a research, but how we can manage our already existing researches of the different researchers in all of Egypt. I mean, the university, the research centers, and different actually researchers who are interested in the field of pharmaceuticals. We try to produce this type of cooperation to join the university and the industry in one company. And we have also the incentive law of the universities now in Egypt has been launched. We have to take the advantage of this law how we can produce this company, and how far this company is accredited from the Egyptian Drug Authority. We need also to focus on this area. I do like to do more research, or our main vision is not to doing more research works, but we have to consume, we have to use the actually produced researches. I mean the practical one or the applicable one. There is a big difference between the academic research and the applicable one. That's why we need actually to put our hands on this area, and how we can do this in our next strategy in the near future, inshallah. The next things also, we have some obstacles about the Egyptian law of pharmacy. The pharmacy law also
احمد معلش بقى افتح فيسبوك شوف الفيديو معدول ولا لا.
1955, which should be, and now we in the council. I'm a senator now and in the Egyptian Senate, can upgrade the law of pharmacy law. That's why we need also to put our priorities. A lot of things actually in this strategy, how to encourage the investor to go through the area of manufacturing of the modernized, to highlight the educational way of education of the pharmacy. And I do believe we achieved a great success in the last year. Since 2 years ago, we launched the new actually strategy of Egyptian education of pharmacy. That's why we need also to put this vision in front of the decision makers. How we can achieve it in the future, that's actually put our eyes on. Also, a lot of things regarding the counterfeit products. Also, very bad issues. I do believe that the whole world is suffering from these issues. The counterfeiting also is one of the most important things that we have to put our national program for fighting of the counterfeited products. Also, these issues we have to also highlight it in the future. We need to put our eyes on a lot of things actually, including this strategy. Almost the 10 obstacles or 10 issues we have to discuss it. I don't believe that my speech today will cover all these points, but I try to discuss the most important points in this issue regarding the relationship between the university and the industry, and how we go through the most modernized biological medicines, how we can modernize the pharmacy law, and a lot of things actually. If we have enough time, we can discuss it later, inshallah. Thank you so much.
Thank you.
Thank you, Dr. Mahi.
This is Dr. Abdel-Nasser. I have a comment and the question to Dr. Mohi. The comment regarding the relation between the industry, pharmaceutical industry, and the research and the universities. And as a matter of fact, I think most universities, and in particular Ain Shams University, is going into this direction, such that we asked, as a matter of fact, we did a protocol with a sector of the pharmaceutical industries to work with us hand in hand, not only in research, but even in revising the curricula for the undergraduate as well as for the postgraduate. Second, we invited a considerable part of the pharmaceutical industries to Ain Shams University facilities as a consultancy office for them. So we are going into this direction because it's the way that it should go. Whether we are talking about third generation or fourth generation,
right?
It has to be like that. The research should have an impact to solve the solution of the society, including the pharmaceutical companies. It should have an added value to the economy of the country. This is my comment. My question is that in view of the COVID-19 pandemic, with interruption of the supply chain, with change in the priorities of all countries, what did this pandemic, in your opinion, has changed in the policy of pharmaceutical industry in Egypt in particular? How did it affect it as regard the priority of the industry and the path for the coming, let's say, 5 years?
Well, would like to thank you so much, Professor Dr. Ayman, and I'm agree with you 100% about the cooperation of Ain Shams University. Because I'm actually board member of the Faculty of Pharmacy, and I'm signing already a protocol with the university or the Faculty of Pharmacy regarding how we can put our hands together to solve different problems. And I do a lot of studies actually at the Bioequivalence Center in the Faculty of Pharmacy, and especially my dear Professor Dr. Abdel Nasser. Actually, interesting to have this research center at Ain Shams University, and I do believe that it will help us a lot to put our hand together. The issue is how to join, actually, in a business way, the practical or research, how we can put it in the area of industry. This is actually very difficult because the Ministry of Health, the previous part, now we have what we call it Egyptian Drug Authority, is now controlling this. We have a lot of laws actually make an obstacles or to achieve the research or change the research from the area of research works to the area of industrialization of this research works. That's why we need to have this type of cooperation, and I do believe that we will dissolve it in the near future. And inshallah, you will hear inshallah good news from the High Supreme Council of the Higher Education. Regarding your question, Dr. Ayman, about the pandemic of COVID-19, well, actually we suffered a lot. You know, in Egypt, the drug misuse actually in Egypt may be, or actually put us actually in a very critical situation regarding the consumption of medicines with or without prescription. You know, the previous period put us in this critical situations. And you know, all Egyptian peoples, I do believe that the whole world consuming a lot of vitamin C, zinc, and azithromycin, and a lot of products actually without prescription. But actually, Egypt tried put their strategy, the Ministry of Health, to cover or to cover the need of the Egyptian people of all type of medicines. At the starting or the beginning of this pandemic, we face a lot of drug shortage or product shortage in Egypt, like the antibiotics, the vitamins, some sort of even the antibiotic drugs. But after that, we recover this, and we put another strategy to import more raw materials from the different companies worldwide, and we exceed our manufacturing facilities to produce more products of this type of products. And for myself, actually, doing a very important research with a group of physicians, professors, whom are specialized in the chest professors. And we do a very important research about treatment of COVID-19 through what we call it ivermectin. Actually have the honor to be to have a patent of ivermectin since 2001 for treatment of certain skin disease. And when Australia, Monash University, launched their important research about the efficacy of ivermectin, we actually introduced these products in Egypt. And I do believe that one of the most important drugs or products in the protocol of the Ministry of Health for treatment of people whom are suffering from COVID-19. So we actually offer the ivermectin and imported the most important products from America, from US, which call it remdesivir, and also flavivir, also from different countries worldwide. We also offering these products and now available in the markets and in the hospital without any shortage. So I do believe that the second wave and third wave of COVID-19 has been actually totally covered by different type of products, which is specialized for treatment of COVID-19, as well as the medical supplies and medical appliances, like masks, gloves, gowns. At the start or the beginning of this COVID-19, we suffer a lot actually because there is some of misusing of these products, even pharmaceutical one, as well as the medical appliances or supplies. But now we don't have any problem regarding the availability of the pharmaceutical products as well as the medical appliances. I hope that I'm having your question actually.
Thank you, Dr. Muhi. Dr. Abdel-Nasser or any of our participants would like to ask a question or comment to Dr. Muhi?
Is there someone wanted to ask Dr. Muhi?
هو عبد الناصر فتح كلام.
My question, Dr. Muhi. Please, Dr. Muhi.
Please. Yes, hearing you.
You touched the way, and we talk about it since years ago. Please, can you put us in the situation and the future of biological in Egypt?
Well, Professor Dr. Abdel-Nasser, actually, we don't have. I do like to say it. Actually, we don't have a lot. Even 2 facilities only in Egypt are now trying to producing biological medicines. One of them was producing the interferon, which is now not actually broadly used, and erythropoietins. The second one producing insulin crystals, but not manufacturing the insulin crystals. I mean, they imported the insulin crystals from abroad or from outside Egypt and formulating the insulin in the form of vials, as you know. But till now, we don't have a serious trial to produce the biological medicines. I mean, the most important biological medicines that we need in Egypt, the hormonal therapy, the anti-cancer drugs, the growth hormones, which is very important. Actually, also the sexual hormones, very important, also to produce it in Egypt. Especially the whole world is now transferring from manufacturing of the anti-cancer drugs, from the chemotherapeutic agent to the area of the biological medicines. And I do believe that is very important to transfer technology or tech transfer from the different countries worldwide or companies worldwide, especially the most famous one. You know, the area of biological medicine nowadays in the whole world is very important. Now, if you have an give a look about the GSK Egypt, now they try to sell out their manufacturing facilities of the traditional medicines, because the biggest player or the big player of the pharmaceutical producers now switch or goes to the area of biological medicine, not the traditional medicines. You know, maybe 5-10 years in the near future, you will not hear about the traditional medicine as that much. All the incoming or the expected products will be biological one. That's we have to have a strategy and encouragement or investment scheme for the investors to go through this area of biological medicines. Actually,
Dr. Muhi, may you agree with me about the obstacles for the joint research and industry sector? You know this. course, I think, which is about how to register as a drug. You know this problem. You have to bring the reference material or reference
yes,
from
right
outside.
you are. Right you are. Hello, Dr. Abdel Nasser.
This is a capture for the
yes.
Talk about this point. You have to change this problem.
Right.
All stop the research at the little no promotion for to drug application or to
yes.
formula and so on.
Right you are. I agree with you 100%, Professor Dr. Abdel Nasser. And we suffer a lot actually from this decree. It's a ministerial decree. It's not actually a law. And we try hard to change this decree or this things, but unfortunately till now we don't succeed to change this decree. Actually, if you'd like to introduce, if you'd like to produce new products, and I mean new here, one of the new drug delivery system, new drug combination, new indication, natural products, or either biological means. And if you have the patent, your own patent, your Egyptian patent, and if you'd like to produce these products in Egypt, you have to go through a very difficult pathway to produce this product, because in Egypt we actually agree about to register a new products. It will never register unless it should be registered in one of the reference countries worldwide, which is 230 countries worldwide, called the reference countries, like US and European countries. So I have to go through Europe or States to register my products in Egypt. Is it logic? Actually, they don't mind to register your products, but they put you in a very difficult pathway and very tough committees and very tough discussion with you to get your approval to produce your products. And I have actually to my personal experience in this, producing of ivermectin, as I mentioned before, and also vitamin B12 sublingual. I changed it from the injectable route of administration to be sublingual. It's not a big deal, it's not a big difficulty actually. To register this new drug delivery system, I consumed 5 years to produce it. That's why this issue to depend on the reference countries and not trusting yourself and your country as Egypt as the reference country, it's a big mistake actually from my point of view. That's why this decree should be changed, and I agree with you 100%.
Dr. Muhi, I think in this period we have to touch this hot issues, which is very important, and they link it directly to the strategy of drug or pharmaceutical in
right.
Okay, thank you.
Thank you, Dr.
Is there any question?
Dr. Nasser, I'm afraid, although we have very interesting comments, and but we have now to move to our second speaker. Thank you, Dr. Muhi, very much. We enjoyed.
Thank you so much, Dr. Ayman and Dr. Abbas.
And we hope to see
you
more frequently at Ain Shams.
Thank you so much, my dear friend.
Our next speaker is Dr. Tamer Amara. He is a professor of neurology, but he is very much into the business of virtual hospital and telemedicine. As a matter of fact, he introduced this concept about 6 years ago as a unit in the neurology department. Then it widened and became now a big unit involving all specialties in Ain Shams Faculty of Medicine, and he is director of Ain Shams Virtual Hospital. He's going to give us a presentation about the digital health towards meaningful use. Dr. Tamer, please.
Professor Ayman for the nice introduction, and I would like to thank the conference organization for the invitation and for organizing this important session. And I would like to highlight early on that this effort started 6 years ago under the supervision of Dr. Ayman and Dr. Mahmoud in the faculty and hospitals of Ain Shams University. And until this day, they are supporting this initiative from their new positions in the university. I would like to discuss today how digital health can help improve what we are providing in terms of healthcare services. There has been a lot of interest about digitizing everything. Healthcare is always lagging all over the world in adopting technology for different reasons. I hope I can shed some light on this topic. So to start, I think the first question that we should ask ourselves is why we are doing a certain thing. So why we are adopting technology? Is it a target in itself? Is all technology good or all bad? So is it just a nice gimmick that we want to have to say that we are using technology, or we want to go paperless? Is it all about storing data so we can retrieve it later, or we can use it for our research? What if we are a practice institute that we are not doing research, we need it or not? So I think the why is that we want to have a better healthcare. This is our why. And the value of care, the value of anything basically is defined as an equation relating quality and cost. And the lesser cost, the more
انجن اللي انت عملت كده انجن بس الباك جراوند
انا ما لعبت في الانفو.
ايه؟ لا هي باظت عندي. طب مصطفى الباك جراوند باظ.
Is it all about storing data? We want to have individuals, the institutes, and the healthcare policymakers is what defines success from failure, in my opinion. So people would argue that technology had its drawbacks. So for example, some statistics show that 40% of the time of practitioners goes to filling electronic forms. This means more staff, this means a more expensive service, this means less time with patients. What's even more difficult is that statistics specifically from the US say that 90% of the records are not visited again. Basically, it all depends on how we are building our systems and why we are building it. If it's for reimbursement, then the whole issue is to have correct diagnostic codes for the coders and the billing departments to be able to get reimbursements for the institutions. An important objective, but should not be the only one. Data from EMR's analysis, when they try to do some artificial intelligence protocols on the data, report lots of missing data, and even more difficulty, lots of flawed information. So if the records has the word rheumatoid arthritis, for 10 patients, usually maybe 5 of them would actually have rheumatoid arthritis. So this is serious when we are trying to adopt higher end technologies to analyze the data that we have. A simple example to illustrate efficiency is the comparison between Singapore and USA healthcare systems. In Singapore, they use 4.5% of their GDP. They spend $2,800 per capita for healthcare versus 18% of the GDP and $11,000 per capita in the US. Someone can argue that US is more expensive, but it's only 3.5% more expensive. Now, this is the expenditure. What about the outcomes? Actually, healthcare outcomes are better in Singapore than in USA, are better in South Korea than in USA. Some healthcare systems manage to keep the prices down and the quality up. A very simple example that illustrates this is that in Singapore, they did this study. They tracked 15,000 individuals for their medical records for 15 years. And they had almost zero data losses. We can compare this with the much higher investment in other countries where many institutions can be digitalized, but the system is not patient-centered. So I have my data in Institute A, but if I cross the street to Institute B, I have nothing. So it's about the value and about how we build our system. So a strategy is an essential, absolute prerequisite for any meaningful use. Some of the perceived barriers is cost. And this is a couple of examples from the WHO. The picture is for Dr. Hani Farou, an Egyptian who is working in the Afro section in the WHO. And he just recently announced that 40 countries in Africa are declared wild polio-free. He's a close friend, and I discussed how he did it despite the limited resources in Africa in terms of internet, infrastructure, and everything. So he depended on very simple tools. GIS was a big part, Geographical Information System, of what he did. So basically what he needed is an address, and then he would confirm the address of every person. And he ended up with a dashboard that was reflected in the office of the minister of most of these countries, just telling him exactly where are children being vaccinated, where they are not, if any case appeared. And all of this data were a click of a button away, and the input was maybe 10 data points maximum. So it's about asking the right question. In Ain Shams, we adopted this, we call the Treat and Teach initiative. We blended online education, telemedicine with mutual visits between countries, because our aim was to improve healthcare services in underserved areas in Egypt and in other countries in Africa. We did this hybrid model for medical education. At that time, especially in clinical medical education, was considered partly unique in 2016. And we managed to open new services in other countries with minimal costs, basically a Zoom subscription and a couple of airplane flight tickets for our staff to visit them, and then for their students to come visit us in Ain Shams. And what we found out, and this can be a continuation of Dr. Muhyi's talk, is that the need is not only for medical education, but also for the kind of the right equipment needed, the medications needed, the management needed. So a more comprehensive approach and an integrated healthcare package that I think we are able to provide to other underserved areas. COVID has been a mind opener for many. And I don't think we have invented new technologies, but we just realized the capabilities of the existing technologies, and we had the belief, and maybe we mitigated the pain of change to use it because there was no other solution. So telemedicine was not invented with COVID. It was there, but its adoption is what mattered. And then it moved from being adopted as a gimmick in 1% of the services provided by a certain institute to implementation phase where it's integrated. And this is another key issue for meaningful use, integration into everyday work. So it's not a parallel universe. We see the patient one time in the outpatient clinic and the next time by telemedicine. It's the same system and the same service. And this is how we improve efficiency, improve quality, and save time. Healthcare workers' attitudes can be another barrier. And this is a a compilation of very interesting PhD studies done on the Egyptian case specifically. And healthcare workers were resistant a bit because of certain factors listed here. So the perceived usefulness of the system. healthcare workers are not really interested in storing data for a healthcare policy manager or healthcare organization, unless they have to, of course, or they are forced to. But the perceived usefulness in day-to-day work, is this system helping me become a better doctor, delivering a better service or not? Computer anxiety is another issue. The feeling of being tracked all the time, so losing the professional autonomy and perhaps being more accountable for every word that I write in the document. Practicing defensive medicine for that purpose. Of course, the workload and the incentives, if doctors are working in 5 institutes at the same time, then he wants to always cut corners when it comes to finishing his work and running to another commitment. The value for the patient is also very important. For example, we have this patient-related outcome measures where we measure how patients are perceiving how good the service is. It's not how the doctor is dealing with them. It's not if he was smiling or if he was describing in proper detail the problem to the patients. It's how they actually improve. So, for example, we can measure the rate of readmissions after an ICU care. We can measure if a patient is back walking again after a joint transplantation, a joint replacement, I'm sorry. So after a hip replacement, the operation can be perfect, but maybe the patient did not go to physiotherapy, so he's not walking after 3 months. So the operation succeeded, but the whole system of care did not. And lastly, the social influence, the peer influence, the attitude of the administration towards the EMR work and how they are filled by the doctors is another factor in e-health, in healthcare worker attitude towards adoption. This brings us to some priorities for the future of EMRs. So, for example, artificial intelligence can help us be aware of our context. For example, a patient presented to the emergency department, the data may be prioritized in the emergency department physician, so that an old ankle sprain is not on top of the list of the patient data, but maybe what more relevant information are. Decision support. So, for example, if a certain investigation proves negative, the system can suggest that maybe this is a probable alternative diagnosis that you should consider. This is a better investigation. If you're considering pulmonary embolism, it's better to do a CT than an X-ray, for example. A very important topic is how to use technology to have connected care. So having patient-centered rather than institution-centered digital health records is of paramount importance in this regard. Having interoperable systems, so basically I can go from Institute A to B and I have all my data in A and B when I present to a third doctor, is what makes a system efficient and practical and saves a lot of time and money and improves efficiency. Practice KPIs can be monitored over time. The practice KPI is not the number of discharges only per hospital, but also how a patient is doing after 3 months from discharge, even if he does not show up. Are we outreaching to our patients using technology or not? Knowledge is another big barrier. And the problem with health is that we're usually waiting for someone else to do the job for us. We are waiting for an entrepreneur. We are waiting for a tech-savvy person to find the solution for our problems. They can definitely help, and they should. But tech people are not aware of evidence-based medicine. Tech people bring apps, and unlike medicines that go through a rigorous process of evidence-based medicine before being used by the public, apps are simply, we find them simply on the App Store, and we have to use them with no scientific backup of evidence. And this is a big role for academia, in my opinion. And the bottom line here is that healthcare should drive ICT, because healthcare has the why. They know the problem. So this should be the start. We should not be waiting. We should be working with the ICT, but we should be driving it. And the other big thing is that technology and the interface between healthcare and technology, healthcare and economics, healthcare and management, all of these interfaces have technology usage, even it's not only data science, not only informatics, but even pure management. You cannot manage now without data. Everything is data driven. So the education in this part, we have in many countries a big void in the number of trained people who are aware of this interface between healthcare and technology. And I think this is another big job for universities to fill this gap, because simply we cannot go to war to digitize healthcare in a big country like Egypt without an army of trained practitioners who can help with it. In many institutes around the world, there are many healthcare and technology departments and institutes that have physicians and computer scientists and engineers working together in the same department, losing their hats for the sake of a bigger purpose. A last item that I would like to mention is that as technology evolves, we have new types of data. So we have 24/7 monitoring data real time that were not available before. And there is no guidelines to manage this data. For example, if a patient with Parkinson's disease walks 6,000 steps per day and then started walking 5,000 steps for a week or 10 days, there's no clear guideline in our literature that says what I should do next. It's intuitive that I should look into the cause, but these data needs new types of research, new types of evidence generation. Evidence-based digital medicine is still, in my opinion, immature and is different from drug trials because it's context specific. If I want to look into patients who are discharged from an ICU and I want to look into the readmission rates and how I'm managing this, there might be systems in place in different countries. So it's more difficult to do a multi-center, multi-country randomized controlled trial because contexts are different. Another issue is that it is suggested that we move from randomized controlled trial to what is called pragmatic controlled trials. Basically, I look into a timeline of events and I see how a certain intervention or a certain dose of intervention may change over time rather than in comparison to a control group. Similar to quality improvement type of thinking, timeline studies. Of course, healthcare systems and policies can be a barrier. We discussed the US model, but and we discussed the fact that there's no point in having a paperless system if I have a problem when going to another hospital that I have zero medical records electronically. Another issue is that we promote innovation all over the world. Hundreds of apps are popping up, but these result in data silos. And as I've said, the evidence of impact and the scientific background is not usually very well studied. There's no real governance for this. And this leads to a disintegrated, disorganized healthcare system. A healthcare policy that would adopt certain clear, published interoperability standards can benefit from good ideas provided by entrepreneurs within a bigger context and within a certain framework so that we can benefit from or increase the benefits from innovation and entrepreneurship. Looking into how we measure our performance. Right now, most countries get reimbursed based on the number, on the volume. So seeing 10 patients will bring us more money than seeing 5. But moving to value, how many hip replacement patients actually went back to their normal lives may be an alternative way to measure efficiency. One system looks into how we can do, if we do 10 MRIs for a patient, then we get more money. Another system looks more into judgment, how we become more efficient. They call it payment for performance. rather than payment for volume. So this system pushes institutes to have connected care, pushes a certain hospital with a big OR to connect to another facility and to share their medical records with another facility for rehab, because they want 90% of their hip replacement surgery patients to be back to the normal activities of daily living, because this is how they'll make more money, and how this is how they can measure against competition, which is different from just asking for more investigations. There are many initiatives around the world for a one person, one record initiative to have a patient-centered type of digital health. This can be per country. There are many initiatives to adopt e-prescription systems. This has saved millions of dollars, improved practice, decreased subscription mistakes, improved how we do our refills, increased our compliance. I mean, it's a long list of benefits. We should look into the social determinants of health, basically how a patient eats, how a patient drinks, the amount of exercise, the kind of air he is breathing, the pollution level, the occupation, his socioeconomic status, his education. All of this has been shown to reflect on healthcare outcomes. We have discussed interoperability and its importance, and how it's important to measure value-based care. Right now, most institutions look into sick care. So we take care of our patients when they are sick and they come at our doorstep asking for help. But what about healthcare? What about looking into prevention? What about considering the economics of chronic illnesses in an aging population? What if we improve the care of diabetes or hypertension, so that we have this objective that instead of having 100 patients with diabetic comas presented to our emergency department from a certain district, we have 50, and we can look into such prevention models. But at this point in time, these models are not reimbursed. So if I'm a private hospital and I do this, I'll actually make less money. So no one is really pushed to look into these aspects. Another important strategic objective is to push services away from hospitals. AI can help us, but we have to define a clear question. So for example, I want to know patients discharged from an ICU who are at a higher risk for readmission. AI can help with this, and I can devise a certain program of follow-up so that we can decrease this chance. So the knowledge and asking the right question is the key, I think, is the key thing that matters. This is my last slide, and as a conclusion, I think what it takes to have meaningful use is to identify the problem owner, ask the right question, have the right vision and strategy, have the readiness to change, not just managing the pain of change, having people who are ready and have the knowledge in this interface between healthcare, technology, and management and economics and so forth. And of course, the executive management who can get the job done. I would like to thank you for your time, and I would like to, of course, I'm happy to answer any question. Thank you.
Thank you, Dr. Tamer, very much for your informative talk. Of course, this topic of telemedicine has different aspects and different prospects that needs more time. However, unfortunately, we are limited in time, but I might give myself the right to ask you a question about the current state of the medico-legal issues in telemedicine. What's the current status in Egypt in particular?
We looked into this for the last maybe year and a half, and I can say there are tiers of it. So in terms of university hospital, we looked into who is governing our practice. And then we have the Supreme Council for University Hospitals. We discussed this with them, and they are
وأنا رديت حضرتك وفسرت ووضحت بس هو الراجل مصر ان هو مش فاهم، مصر ان هو مش عارف حاجه، مصر ان هو يعني يا هو حمار يا يعمل نفسه
The University Council
زي ما حضرتك عارف الهدف الاسمى ان انا ايه؟ اطلع ببزنس، اطلع بايه؟ بشغل. انا راجع هطلع بايه؟ هراجع كده مكانا وبتاع، ماشي ينفع. فانا دكتور رديت على قد ما اقدر، والله رديت على فكره يا دكتور، انا رديت وبينت ووضحت. والدكتور وائل حضرتك اساله هل محمد الديب رد ولا؟ ورديت في 3-4
Please,
رسائل
someone is
ووضحت
please
وبينت.
mute
دي
our
مشكلته،
microphones.
لكن هو ما زال بيعند ولا، والعربي ومره معترض على العربي ومره معترض على الانجليزي. هو انت بتفهم عربي ولا بتفهم؟
Council of University Hospitals gave us a clearance to practice. This is just but one level. At a national level, we talked to the medical syndicate and they're looking into it, and I think soon they will clear it as well. And then as a matter of a regulation that governs the country, we currently have a data protection law that was issued a few months ago. And what's in the pipelines is a dedicated law for healthcare data. And I think we should be able to see this new law specifically for healthcare within the coming few months. So this is regarding one aspect of the legalization. Another aspect is the type of practice. So for provider to provider, usually we manage it so that in the terms of conditions, especially in cross-border telemedicine, through terms and conditions, because it's very difficult at this point in time to have a universal law. It does not exist. But we usually have our opinion as a second opinion. So usually we refer the responsibility to the primary treating physician. But it's more tricky with the consumer to provide where the patient is talking directly over the phone or over a telemedicine channel with the doctor. And this will be finally managed through the new law that is currently in the pipelines.
Thank you, Dr. Tamer. Thank you very much for your answer. I would ask Professor Abdul Nasser Gad to introduce our next distinguished speaker, please.
Okay. Next distinguished speaker, Dr. Professor Graham Ball, Professor School of Science Technology. He supervised the bioinformatics team undergrad and postgrad research project. He also teach on the modules bioinformatics and statistics. And environmental science, the use of artificial intelligence for discovery of bioinformatics and drug targets, breast cancer perspective. Please, Professor Graham Ball, we are happy to receive your presentation.
So, good morning, Sabah Alaika. Salam alaikum, and thank you for the opportunity to speak. And it's my great pleasure to meet all of you and talk this morning. So I'm just going to share my screen. Just bear with me a second. Okay, so I've been using machine learning and artificial intelligence in the domain of biomedical data since 2000. And I've developed a number of machine learning algorithms for application to biomedical data and health data. And I should also say that these technologies and these methodologies have now been commercialized through a spin-out company called Intelligent Omics Limited.
Professor Graham, would you please make the presentation full screen?
Is that better?
Thank you. Yes, excellent. Please proceed.
So in this context, we are looking at breast cancer, and this is one of the most common cancers diagnosed globally and in the UK in particular. And what we've aimed to do here is develop methodologies to identify therapeutic targets, identify molecular pathways, and identify biomarkers of disease. So we have worked quite closely with our local and national hospitals in this space. So with Professor Emad Raka from University of Nottingham and Dr. Tarek Abdel Fattah from Nottingham University Hospitals Trust. So the real advantage in this space is that there is a lot of data. And there's an opportunity here in that we can obtain large amounts of molecular data freely from public repositories. And in this case, there are around 3,500, 4,000 cases that we can get molecular data for. So that creates a big opportunity for us to understand the disease at the molecular level. However, that data is extremely complicated. It has tens of thousands of features, and it's very difficult to look through that and find patterns without some sort of assistance. So the way we work to deal with that is we use a principle of a method of artificial intelligence called an artificial neural network. And this is uses a similar model to biological neural networks in that there is a transformative process transforming input values to output values, and the network reinforces patterns that it sees. So, for example, these networks can learn a solution to a problem. So they're very good at classification. So we can identify patterns that will, for example, classify into a different molecular subtype of cancer, or we can classify into an individual with high risk or low risk. But also they can be used in regression. So, for example, we can identify parameters that predict a given gene or expression level of a marker. And one of their key strengths is that they are good at parameterization. So from these vast numbers of molecules and features, we can identify the key things. We can identify the most important features from this complex data set that address the question we're trying to answer. So to summarize then, these methods can learn, they can find patterns in data and apply them to new data. They can generalize, so they're good at predicting well for things they haven't seen before. And very importantly in this space, they can cope with very nonlinear and complex data, like that in the human transcriptome, for example. So the way we develop this approach is we have an adaptive system. We have an input, which is our information from transcriptomes, and we have an output. And the output is a prediction of a question we're trying to answer. So, for example, high risk, low risk breast cancer. And that approach generates an error. So when the network makes a good prediction, the error is low. When it makes a bad prediction, the error is high. And that's determined by comparison to what actually happened. So it's a supervised approach. And then we have an algorithm, which is the artificial neural network, and it changes the parameters of the network. And it cycles round and round until it gets an acceptable model where it stops. So we present the data to the model creates an output, and we update the parameters, the weights of this network, to reduce an error. So it's an adaptive mathematical function. And so if we look at the error drops and reaches a minimum. And at that point, we could say the network is trained. However, if we look for the ability of that network to predict for unseen cases, unseen samples, then it drops to a minimum and starts to increase. So our goal is to try and stop it at the point here when the unseen performance is at a minimum. So we test the network on this unseen data, and then we stop when the performance fails to improve for a number of events. So the purpose of this is to develop a model that works well and predicts well for new unseen cases, that predicts well for new patients. Because, as we say, it's all very well having a model for, say, people, just the breast cancer cases in Nottingham, but we want to apply that to a more global solution. So that's what we're trying to achieve here, to get what we call a generalized model. Now, there's many approaches into this, and many of you will have heard of deep learning. Deep learning is an emerging approach where we have very complex networks with lots of layers and lots of features. And these can be very resource intensive. They can take literally months to train if we don't have the right computing resources. Well, we've developed an approach which is much more constrained, and that is much more efficient, particularly at molecular data. So our goal here is to find from the human transcriptome a enriched set of markers, of features that address a question. And if we look at the distribution of our performances, and this is the ability here to predict metastasis before or after 5 years in a breast cancer cohort. This is from the Van Veer data set presented in Nature. You can see here that we have this sharp hook. A very small percentage of the genes are very good at predicting the question we're trying to answer. In fact, a single gene here is able to predict with 78% accuracy whether a patient will have a metastasis before or after 5 years in breast cancer. So we developed these methods and we're applying them to particular questions. And one of the questions we're applying them to is to understand the role of P53 in the breast cancer context. And it's important because it's commonly mutated. It's associated with tumor aggression if it's mutated. And if it's not mutated, it can act as a protective mechanism. It's anti-tumoral. And it's involved in a number of different roles. It's uncontrolled cell growth, regulation of proliferation and cell cycle, apoptosis, DNA repair, and inhibition of angiogenesis. So it's sitting very central in the processes that cause breast cancer, and in fact many other cancers as well. So the way we went about this is we wanted to understand more about the P53 pathway. So we pulled the features of the P53 pathway from the internet, the KEGG data set. So this is a representation of that pathway. And each one of these molecules is represented in our omics data sets. So on the expression arrays. So this allowed us to identify the level of expression of every feature in this pathway. So we wanted to identify the things in the P53 pathway that were related to in breast cancer. We wanted to study how they interacted with one another and whether there were any new features that could be discovered by mining the data using the ANN approach, and whether there were any biological associations between those things. So were there any drivers of the P53 pathway that we could discover? Now, if we can discover drivers of the pathway, then we can investigate these drivers as potential drug targets. So we can say, can we drug a particular molecule in the P53 pathway that will have an impact on that pathway? And essentially, we were trying to answer the question, can we develop an in silico pipeline, so an approach which uses computational methods for drug discovery based upon omics data using machine learning? In other words, if we can automate this process, then we can rapidly circumvent many of the high throughput screening approaches that are used in drug discovery, which are very costly and which take a long time. with the in silico methods, and here we've used those, we can do that same sort of work in a matter of days rather than a matter of years. So the way we're trying to do this, let's say we have a known pathway where molecule X links to molecule Y, linking to molecule Z. Molecule A links to X, molecule B links to X, and molecule C links to B. So what we do is we take this pathway, and here in this situation, it's the p53 pathway, and we identify, using the machine learning, the things that interact from the whole transcriptome with each target. So the first, we identify the interactome for target A, and then we repeat that for each marker in the pathway. So in other words, we're finding the relationship between every member of the pathway and the whole transcriptome. What we then do is we can enrich based upon this distribution of errors and say these are the key genes that interact with each of those features. So now we've got an enriched set of genes with molecule A, an enriched set of genes with molecule B, an enriched set of genes with molecule C, D, E, and F. So, and these are not genes at the DNA level, these are genes at the transcriptome level. Now, by looking at the membership of these lists, we can start to say, well, there are new features coming in. There are features that here, for example, link between these two members of the pathway. There are features here that link between multiple members of the pathway. And so by doing this, we can use the whole transcriptome to fill in potential gaps in the pathway using a machine learning approach and using that as a way of identifying evidence of these new features. So in a way, we are moving away from a hypothesis, but we are expanding upon the existing hypothesis using an evidence-based approach. So using this, we looked at the p53 pathway and we identified a number of new features, and those are here listed in, or shown in green. So effectively, we could create a p53 pathway plus, a p53 pathway with new features in it.
Professor Graham, are you present?
Hello? Can you hear me?
Yes, we hear you, Professor Graham. We hear you.
Yes, yes.
Sorry, is everything okay?
Yes, everything's okay. We can hear you.
Ah, okay, good, good. So what we then do is with our p53 pathway plus is we have an approach called inference modeling, and effectively what we're using this for is using transcripts to predict transcripts, genes to predict genes, and we can study the interactions between things in the data of the disease state. So we can effectively identify from this the amount of influence a molecule has on the system. So what effectively this is a form of systems biology using machine learning. And that it works a bit like this. I'm just going to skip to the next screen. So let's say we have 16 molecules of interest. What we use is 15 of those molecules to predict one using, again, artificial intelligence, machine learning. And we can, from that, identify the strength of those parameters' influence. So we can say, here represented by the thickness of the lines, this feature has a very strong influence on this target. This feature has a very weak influence. We then repeat that for the next marker in the list, and we keep going until every marker has been used to predict every other one. Now we can put a sign on that, so here represented by the color. And And then we can use something called Cytoscape to create, in effect, a network view. And from that, we can see that some things have a strong influence, some things have a weak influence, some things have a positive influence, some things have a negative influence, and some things have a bidirectional influence and potential feedback loops. So by doing this with our genes of interest in our pathway of interest, we can find new features, new drivers of that disease state and of that pathway. So in reality, this is what the model looks like when we don't filter. This is effectively taking out 80% of the weights. Otherwise, it's just completely even more of a ball of string and you can't see any patterns in it. But then when we start to filter further, you can start to see features that are strongly connected in this pathway. So for example, here, this TNFR F10C is strongly influenced in the P53 pathway. CDK2NA and HSPA, all strongly influenced features. So if you wanted to change the P53 pathway, these would be quite good contenders to utilize. So we've gone from data sets at the molecular level for disease, we've gone from a pathway hypothesis, and then from that, we've modeled that pathway to identify the level of influence of each feature. Once we've got those features, then we can start to potentially identify what might influence them. And so for that, we go to a database called DGIDB, which is the Drug Genome Interaction Database. And from that, we can see, for example, one of our hits was TP73. We can see potential molecular compounds, and these can be new chemical entities, or they can be existing drugs. They can be biologics, or they can be small molecules, but we can find things that might interact with those features. So here we've got, this is NPR1, one of other hits. We've got a small chemical, a small molecule, a new chemical entity here, but then we've got existing drugs. So there's a potential repurposing role for these, as well as a potential of new drug discovery. Now, some of these methods we've developed and we've validated quite extensively now. So, for example, in this piece of work, we were looking at SPEC5 as a marker of proliferation in breast cancer, and that's been validated since in 15,000 cases now. And the methods I've shown you in this talk have been used in this context. Now, the next activities we're undertaking at the minute for the P53 pathway is to use CRISPR to knock out some of these compounds, but also apply the chemicals to cell line models and see what effect they have and in the biological level on those breast cancer cell lines, and do they have the effect that we would expect if they were hitting the P53 pathway. So thank you for the opportunity to present this. I'd just like to acknowledge the people who've been involved in this work. So my former PhD student, Demetrios Kapsoulis, does a lot of development work with me. David Bucock in Van Geest Cancer Research Center. My current PhD student, Dalia Mahasi. In Intelligent Omics, we have Simon Howarth, who's our CEO. And then from the clinical side, Nottingham University Hospitals Trust, Dr. Tarek Abdel Fattah, and then the University of Nottingham Professor Ian Ellis, Steve Chan, Ahmed Raka, Andy Green, and Stuart Martin. So thank you very much for the opportunity to present. I'd be very happy to answer any questions.
Thank you very much, Professor Val, for your informative lecture. And I think we can have one or two questions. Dr. Abdel Nasser or any of the audience, if there is a question.
Yes.
Is there any one wants to comment or ask a question? Okay, if there is no comment or questions, so it seems that everything is clear. We thank you very much. We hope to see you next year face to face in Cairo, not virtual, but we thank you very much for giving us from your time and effort and knowledge. Thank you very
Well, thank you very much for your warm welcome, and thank you very much for inviting me to present.
Session comes to an end, and it was a privilege to share this session with Professor Abdel Nasser Singab, my friend and colleague. Thank you very much, and see you soon.
Thank you so
الو
صباح الخير يا دكتور.
الو ايوه صباح الخير.
صباح الخير يا فندم. انا دكتور محي حافظ.
اهلا وسهلا.
اهلا بيك. هو الزوم لسه شغال يا فندم ولا ايه الاخبار؟
نعم
الزوم لسه شغال ولا خلاص خلصت الكونفرنس؟
لا يا فندم شغال ومكملين ان شاء الله.
اللي بعد كده.
دكتور مصطفى صباح الخير.
ايوه صباح النور.
دكتور مع حضرتك ايجي من ايرس. احنا دلوقتي في ممكن نجرب نشير سكرين.
انا اشير السكرين يعني
عشان بس نتاكد ان كل حاجه تمام.
هو على العموم انا مش سبيكر يعني بس حاضر.
تمام خلاص اوكي يا دكتور. سوري جدا لحضرتك.
طيب
دكتور محي
ممكن تجربي كمان مع
محتاجه اجرب مع دكتور محي.
بروفيسور محي هيجي على 11 هو كان داخل.
تمام اوكي. Professor Sin, good morning.
Good morning. Hi.
Hi, Professor.
Hi.
This is Inji from Iris Events, the organizing company.
Hi, Iris.
Can we try sharing screen together? Professor Sin, do you need any help?
I'm fine, actually. Yeah.
Okay. Can you please try sharing the screen?
Okay. You want me to share the screen?
Yes, just to try that everything is okay.
Okay. Yeah. Is that right?
Okay, I'm now seeing your desktop. Can you please open the presentation?
I don't have a presentation. What I'll do, I'll just be discussing some of the items.
Okay, without a PT.
Yeah. Because.
Okay, fine.
Yeah, because I don't think everyone wants to look at the presentation all the time.
Okay, fine.
Yeah.
Thank you. Professor Shahira, good morning. Professor, please can you join with the computer audio? Professor Chen, good morning.
Good morning.
This is Inji from Iris Events.
Hello.
Hello, Professor. Professor, can you please try sharing the screen to make sure that everything's okay?
Yeah, I can, but I'll not be using any screen anyway.
Okay, you're not gonna share any PowerPoint presentation.
No, I'll just be speaking.
Okay, Professor, it's fine. Thank you so much. Professor Karim, good morning.
Good morning.
This is Inji from Iris Events. Doctor, we are now practicing, so can you please share the screen to make sure that everything is okay?
اوكي بس لو ممكن نعلي الصوت شويه.
اوكي حضرتك كده سامعني؟
هو انا سامعك بس
تمام يا دكتور، بس بقول لحضرتك محتاجين نشير سكرين عشان نتأكد ان كل حاجة تمام قبل ما نبقى في وقت السيشن. حضرتك سامعني يا دكتور كريم؟
ايوه سامع.
تمام، بستأذن حضرتك بس نجرب نشير سكرين.
نجرب ايه؟
نعمل شير للسكرين يا دكتور. حضرتك في باوربوينت برزنتيشن اتفعلت؟
لا.
طيب تمام خلاص اوكي يا دكتور.
صباح الخير مس إنجي، صباح الخير على حضراتكم.
صباح الفل.
ازيك يا دكتور؟ الصوت كده واضح؟
أنا واضح بالنسبة لي زي الفل، شكرا.
تمام، اوكي، ثانك يو.
دكتور نهى الصوت واضح تمام جدا.
تمام، ثانك يو.
دكتور شهيرة كده تمام جدا، بس محتاجين نعمل فول سكرين.
تمام
تمام جدا دكتور شهيرة، ميرسي جدا لحضرتك.
okay you will stop sharing.
Yes. Okay, everything's okay.
Okay,
Thank you.
Good morning دكتور شهيرة، دكتور مصطفى.
Good morning دكتور عبد الفتاح.
good morning دكتور عبد الفتاح.
Good morning.
حضرتك ايه، كله تمام؟
ازيكم، اخباركم ايه؟
تمام الحمد لله.
منورين.
ميرسي، يعني النور بيدكم.
ربنا يخلي حضرتك. ده كان في من شويه كده كوميتمنت عايزين يلبسوني فيه، قلت لهم ابدا انا واعد الدكتوره شهيره، يعني واعد الدكتوره شهيره.
تمام منورنا يا دكتور عبد الفتاح.
ربنا يخليك، ده شرف
حضرتك
ليك جدا ليا.
منورنا يا دكتور.
بالذات ليك جامد قوي في موضوع الانترناشوناليزيشن، يعني اول ما يعني زقيت فيه والرانكينج، وانا دايما بقول كده في كل حته بصراحه يعني.
ربنا يخلي حضرتك، ان شاء الله انتوا تعملوا اكتر بكتير يعني ان شاء الله.
ميرسي.
ميرسي الله يخليك.
ربنا يخليك. ازيك يا واحده؟
صباح الفل يا دكتور، ازي حضرتك؟ منورنا.
اخبارك ايه؟ كويسه؟
الحمد لله تمام. الحمد لله.
منوره يعني. فين تامر نادي فين؟
دكتور تامر will join ان شاء الله. دكتور تامر عمرو موجود، دكتور تامر النادي will join.
تامر النادي مش شايفه. اصل تامر النادي وجوده مهم عشان هو اللي هيشاغب في اي حد موجود في الجلسه. انت عارف احنا
انا بعت له ريمايندر امبارح.
الدكتور مصطفى رفعت ريحنا جدا من الشغب بتاعه في كليه الهندسه والله.
لا ما هو دكتور تامر معانا ازاي بقى؟
لا والله العظيم يعني
ما تستناش عن الموضوع ده.
ما تستناش عن الشغب. بتحب الشغب انت؟ طيب
نعمل ايه طيب؟
انا جاهز لما تحبوا تبتدوا، انا جاهز. انا تخش فيك. ازيك؟ اخبارك ايه؟
دكتور مصطفى ازي حضرتك يا فندم؟ دكتور شهيرة ازي حضرتك؟
اهلا يا شريف، ازيك؟
الاخبار؟
الحمد لله.
انا جاهز بقى يا دكتوره شهيرة، اول ما تقولوا لنا نبتدي ان شاء الله.
دكتور عبد الفتاح، بس استاذن حضرتك لو في كمبيوتر تاني مشغل الزوم او اي صوت تاني طالع، بس نقفله علشان بيعمل ايكو في
لا ما عندناش، احنا عندنا هو وان سيستم، ما عندناش حاجه ثانيه.
خلاص تمام يا دكتور، احنا ان شاء الله خلال 3 دقائق هنبدا الفيديو 30 ثانيه وحضراتكم تبداوا على طول.
اوكي
ثانك يو. دكتور هستأذن حضراتكم هنبدأ حالا بالفيديو ونبدأ السيشن على طول.
Good morning, everyone. Dear Chairperson, speakers, and guests, we are so much honored to have you today in our internationalization session hosted by the International Relations and Academic Collaboration Sector, IRAC. We first would like to welcome our chairpersons for this session, Professor Dr. Abdel Fattah Saud, Ain Shams University's Vice President for Education and Student Affairs and Professor of Orthopedics and Spine Surgery, Faculty of Medicine. Professor Dr. Mustafa Rafat, Director of the International Relations Office, IRAC, and Vice Dean for Education and Student Affairs, Faculty of Engineering. Professor Dr. Tamer Nedi, Director of the Grants Office, IRAC, and Professor of Acoustics, Faculty of Engineering. I'm Noor Rafai, Faculty of Medicine, Acting Director of Ain Shams University Projects Unit, Grants Office, IRAC, and I will be your moderator for the first hour. This session highlights the importance of internationalization, opening gateways to dynamic experiences through academic and non-academic collaborations with the universities. It will also shed the light on some successful partnerships examples, starting with a successful model of partnership for development in medical fields between EAPD and Faculty of Medicine, Ain Shams University, that will be presented by Ambassador Karim Amin, Minister Plenipotentiary, Deputy Secretary General, Egyptian Agency of Partnership for Development. Our speaker is a professional Egyptian diplomat of a medical background. He joined the Egyptian Foreign Ministry in 1999, served in Egyptian embassies and missions in Kuwait, Australia, and Sudan. He joined the Egyptian Agency of Partnership for Development, EAPD, which is the development arm of the Foreign Ministry in 2018. And he holds the position of Deputy Secretary General of EAPD since 2020. Dear Ambassador Karim, the floor is all yours, sir.
Thank you very much. Thank you for introducing me. It gives me great pleasure and honor to be here among all of you esteemed professors and to be a guest in your international conference. Actually, I would like to start my speech by a short introduction about my agency, our agency, which is the Egyptian Agency of Partnership for Development, which is considered an arm of Egyptian foreign policy. It is the sole governmental agency which is responsible for dispatching aid and giving arms to other countries to help them in their development issues and acts. My agency, or the EAPD, was launched in 2014 by His Excellency the President Abdel Fattah el-Sisi during the African Summit. But it was not the first attempt or the first arm of foreign ministry in helping African countries, because we succeeded the Egyptian Fund to Africa. Our main aim is to help the other countries, focusing mainly on African countries because of our African commitment and our African belongings. But still we can act also in other countries. That's just a short introduction about us. How do we reach our goals in ensuring and helping other countries in their efforts? Well, we have several aspects of work. One of them, the most important, are capacity building programs. We have capacity building programs in almost all fields: medical, engineering, irrigation, and even with military forces, aviation, and in all parts. We design those programs according to the needs of the African countries. Usually, we cover everything. We cover costs. We cover the air tickets, accommodation, and everything. Those programs might be for 1 week to up to 3 months. We usually invite participants from all African countries. Usually, each program would have between 20 to 40 participants from the other countries. We believe in partnership, not just in giving aid. We believe in partnership to achieve the development according to our name. The other field that we work in is dispatching experts. Once we have about 70 Egyptian experts in African countries, also covering all fields of life. Sorry about that. I was speaking about experts. Right now we have about 10 experts. Almost 8 of them are doctors. They are in countries like Burundi, Uganda, South Sudan. And we also dispatch them according to the need of the receiving country. We pay their salaries, we pay their tickets, we pay everything just to help the other countries and to even to disaster or like floods or earthquake or something like that. Also, and actually during COVID-19, we were very active with other institutions of Egypt, like the military forces, the Ministry of Health, the Red Crescent. All those institutions work together to dispatch aids related to COVID-19. Okay, now let me go deeper into the medical field, which I'm participating today to speak about it. We have many centers of excellences or partners in Egypt, which provide training, aids, convoys, and other things. We are working with the Magdi Yaoub institution and also Ain Shams University, Mansoura University, especially the nephrology department, and other aspects. Now, I've taken lots of time. Let me focus on our successful mission with Ain Shams Faculty of Medicine. Actually, the cooperation between us started in 2017 or 2016. We decided to tailor or to organize two training programs. At that time, JICA was helping in them also. We had two programs every year. One of them was about hospital management, and the other was about overcoming neglected tropical diseases in Africa, which I think is a very important field, which is really neglected, but with your help of your university, it wasn't neglected anymore. In each course, between 20 to 30 African doctors or nurse participated, came to Egypt, had the training, had everything, and went back to their countries so as to benefit their country of what they have learned from you over here. In 2019, 2020, we decided to focus more on the medical field. So we started to think about other fields to cooperate, and Ain Shams Faculty of Medicine was our main partner in that, because you already have international programs, you already have international students, and you were very active and very keen to participate in those activities. We decided to work as in a circle in providing health aid and health development to the other countries. The first part which we started in was the capacity building programs, which was already established before. We continue to have about 2 training courses with you. Maybe last year we just have 1 because of COVID-19, and we were not able to host many of the African participants. But hopefully this year we will have also 2 or more training courses for the doctors and nurses from other countries. We started to look to other aspects which were a need or a must to the other countries, like having, like treating some of their patients in well-organized and well-trained, and with famous doctors. So we cooperate with you in providing maybe the air tickets to some of those patients. And actually, Ain Shams University did cover all the treatment and accommodation expenses. One of those cases which I remember was from Burundi, was a rare case of twins. And I think it is an example for how to work with other countries just to achieve medical services to their people. The other field also, we decided not to send also doctors and convoys to other countries, so as to provide the treatment to higher number and in fields that were not reached or not provided in such countries. In 2020, we cooperated with you in Ain Shams University, and we sent a convoy in ophthalmology to Mali. I have the reports that there were 5 doctors in February. They met the wife of the president over there, and they performed about 250 operations in 5 days. We were planning to send more convoys with you, but also because of COVID-19, these plans were postponed. We started to look further to the future. We said we need to, instead of sending doctors, why not having medical students in your faculty, give them the spot to sponsor them, and to let them study for the 5 years on the expenses of the Egyptian government, and to send them back over there so they will be doctors who were trained and who were educated in Ain Shams University, they will be ambassadors to Ain Shams University and to our agency, inshallah, in the future. We have till now we have 2 batches which are studying. We have students from Burundi, South Sudan, Sudan, Congo, and I hope we will have more students in the coming years with your effort. And the last program that we are intending to proceed in was tailored depending on or according to a proposal from University of Medicine, just to have a postgraduate doctor to have training in your hospital for 6 months. This activity is under processing now, and I hope to start it soon, maybe in June or July. And we will start with neurosurgery. I hope we can continue in this effort and in all the other 5 fields, and to stay a partners for the benefit of African continent and African peoples, and also for the benefit of our country, and to support the leadership and the excellence in medical fields, which was always linked and related to our great universities like Ain Shams and other universities. Thank you, and please, if you have any questions or comments, I would like to hear from you. Thank you.
Thank you so much, our dear ambassador, for this great presentation. I'd like to echo your last sentence when you were saying that partnerships achieve benefits, and I'm happy that we are having long-standing partnerships with your institute, and I hope that this continues in the future. For any questions or discussions, we're going to give about 10 minutes at the end of the session for the interaction with the audience. Thank you so much. It was indeed a great presentation. Okay, so we mentioned in the beginning of this session that it's hosted by IRAC, right? I think it's time to dig deeper into the identity and the integrity of this entity, talking about what happened during the past year. The next presentation will be given by the IRAC Executive Director, Professor Dr. Shahira Samir Zaki, who is also the Vice Dean for Environmental Affairs, Faculty of Medicine, Ain Shams University. Dear Dr. Shahira, the floor is all yours.
Thank you, Noha, for introducing me, and I want to welcome you all. Actually, as Noha said, the title is IRAC in a year. IRAC is the abbreviation of International Relations and Academic Collaboration in Ain Shams University. This sector started on the 24th of February 2020 by a university presidential decree to establish a new sector in the university. And this sector includes 5 offices. The offices and the director of the offices, the team, International Relations Office, IRO, the director is Professor Mustafa Rifat. The Grants Office, the director is Professor Tamer Amara. The Alumni Office, director is Professor Reem El-Kabaliti. International Students and Mobility Office, the director is Professor Shirwat El-Ahmadi. And the Ranking Office and the director is Dr. Ahmed El-Banna, lecturer in dentistry, the Faculty of Dentistry. And myself, of course, the director of the sector. This is the IRAC team. We started all last year in 2020. Our vision was to be or to work as the Center for Globalization of Ain Shams University, paving roads to international dynamic experience through academic and non-academic collaborations with universities, institutes, organizations, graduates and postgraduates all over the world. The mission, our mission was done through the 5 offices by being the center for all collaborations of Ain Shams University with other universities, by promoting and facilitating student and staff mobility from and to our university, providing all types of high quality services to help researchers to engage in academic and non-academic projects with grant funding, to communicate with Ain Shams University alumni wherever they are with all possible services, and to drive our university to pursue international recognition and higher ranking. Our values are that we believe in promoting a safe and healthy community life for people of all races, religions, national origins, socio-economic classes, and gender identities, providing equal opportunities and transparent environment. We also have a deep commitment to diversity, adoption of multicultural engagement, continuous improvement, and motivation. Why working in a sector, actually combining these offices led to create a unique entity where the 5 offices integrate, empower, complement, and has a remarkable impact on each other. Of course, we can all expect that International Relations Office has an impact on international students, which has an impact on our alumni everywhere. It also grants office and allowing or helping a lot of researchers and upgrading our researchers has a great impact on the ranking office, and of course is related to our international relations everywhere by doing combined research. So they are all connected and really promoting each other. The title was Iraq in a year, the toughest year. We all know 2020 was a tough year because of the COVID pandemic. All the world faced a lot of challenges due to seldom physical meetings, banned travel and flights, rapid digital transformation. We all faced this. So our sector, Iraq sector, worked hard with full capacity to overcome all obstacles, to keep supporting the university vision and mission of internationalization. We started by establishing the Iraq website. We can reach the Iraq website through the university website. This is the interface of our university website. And through the divisions, we can go into international relations and academic collaboration sector. And within our Iraq site, we can find the 5 offices: International Relations Office, International Students and Mobility Office, Ranking Office, Grants Office, and Alumni Office. And of course, inside each office, we can find the data platform, the registration forms, the application, the online payment, the services, whatever needed for the specific office. This was the start that we did. And then our extended sector, we are glad and very much blessed by the addition of our 2 young, very active helpers, Noha Al-Rafi and Sharif Al-Sigini. They are the moderators of our session. Actually, Noha is working for the grants office, Sharif is working for the international relations office, but this is theoretical. But the practical thing is that they are working for all of us, doing a great job. And then the sector was extended again by establishing a large network. And this was done by assigning coordinators or representatives for each office in each faculty. So now in each faculty, we have an office for grants, for international relations, for alumni, for international students. So we are now a big and large network interconnected together. Then, for the sake of visibility and awareness, 3 booklets were released. The first was the International Students booklet, which includes a glimpse about Ain Shams University and the list of all the programs provided by the university. It's of great help for anyone searching for what to study wherever, and actually the soft copy is present on our website for anyone searching, as I said, for what to study. Then we released the ranking report booklet, which includes our where are we, or our ranking in the different ranking organizations as a university and as subjects. With a brief about the methodology used by each organization, so we can all know our strengths and the points that need to work on, and it was sent to all faculties. Then we released the IRO booklet, or International Relations booklets, which provides us with all partnerships done by the university with other universities, with industries, with organizations, whatever. Our sector shared in workshops, conferences, examples. First, what is in front of us was done a month ago. This is a capacity building workshop that was done over 3 weeks with TU Berlin, and attendees were our coordinators in all faculties. It was a great exposure to other experiences and to promote our international sector. We shared also in EduGate, in preparing Ain Shams University booth in EduGate, or the university fair that was done 2 weeks ago. Our sector shared or participated also in QS Maple 2020 by a presentation for our experience. It was headed Ain Shams University defies the norm and launches a new initiative. Also in 2021, Ain Shams University is a bronze sponsor for QS Maple. We received a lot of guests thanks to our president and the hospitality of our university. We received ambassadors and cultural attaché from many countries for establishing more collaborations, activating MOUs and agreements, discussing issues related to our students, international students, and so on. These are some photos, examples where Venezuela, Iraq, Korea, Libya, Mexico, and many other. It was done through this. Were done through the past year. We work to make our university and to place it on the world map by valuable agreements and by activating the present MOUs and agreements, the scope and dimensions of our partnerships were to raise the quality of these partnerships, to have workshops and trainings for students, to make more student support, capacity building for academic and administrative staff, to have joint research, and to have industrial partnerships. For the grants and projects office, these two simple graphs summarize it all. On the left side, we can see how the processing time for proposals and project, a lot of papers needed were minimized. Since 2019 to 2020, we can see we may need 16 working days, which is probably 3 to 4 weeks, to 2 days by doing a lot of the job on the platform online, simply by speeding the signatures and all the papers needed. And this was clearly reflected on the number of projects or of applications to projects. On the right side, we can see the ascending line from 2019 to 2020. Number of applications increased by about 50 to 60% than the years before. Okay. For our international students, we currently we have approximately around 6,000 students. I think it's a bit more now because the first year of the university received an increasing number this year. Around 5,000 of them are undergraduate and 900 are postgraduate, including around 78 nationalities. Of course, from the graphs, we can see that most are undergraduate students and a smaller part postgraduate, as I mentioned. For nationalities, the highest number are from Asia, then Africa. And for subject distribution, mainly the medical sector, next humanities, and next engineering. And the largest number are Arabic speakers, but we still have a good percentage of non-Arabic speakers. The International Student and Mobility Office, we use the abbreviation ISMO, did a lot of work this past year. They released a student handbook, which is a living guide that is very useful, including maps in Cairo, transportation facilities, big malls, and famous places. So it's a valuable guide for any foreigner being in Cairo. They widen channels for communication through emails, establishing a Facebook page, and through, of course, the new website. They marketed the programs of the university through the booklet I presented a while ago. They did a registration for around 400 international students in the EKB. They did an orientation day that was done, of course, virtual because of COVID in the first week of the academic year. They adopted spring semester for newcomers. They did some fun activities. Actually, currently, they are running an online talent competition. I think that it will end by tomorrow, and the results will be proclaimed the next year. And some sightseeing trips. And we are now working on initiating services for international students, like helping in the official papers, providing accommodation, such things that may be needed by the international students. And I think by the next year, we will have a release for a clear service sector in the office. Ain Shams University was honored to host also the graduation of South Sudanese students from all Egyptian universities. This event was organized by the Central Administration of International Students in the Ministry of Higher Education, and we received them in our university. For the alumni, now we have a membership card with a lot of benefits that increase day after day, like discounts everywhere and things like this. And the registration is done very easily online with payment online and very simple logistics. They prepare job fairs and vacancies. Actually, 2 weeks ago, we had such fair in the Faculty of Medicine. Alumni prepare and help in the graduation ceremonies and photo album. Of course, this past year, things like this were postponed because of COVID, but this is one of their major roles. They engage alumni in the university activities like conferences, forums, symposia, lectures, and meetings. They listed top students and prominent graduates of Ain Shams University on the official university website. They are planning to prepare annual Alumni Day and Jubilee Day, and they are also planning to prepare training courses to equip our graduates with all the skills needed for the labor market. This is, of course, with cooperation with our training center in the university. Where are we as ranking? This is, of course, is changing every year and is changing between the different organizations. Some examples: in Shanghai ranking, we are internationally between 800 and 900. In Egypt, we are the 3rd. In the region, we are in Africa, we are the 10th. In Times Higher Education, 1001. In Egypt, 10th. In Africa, 21st. QS 800 to 1000. 3rd in Egypt, 8th in Africa, 15th in Arab ranking. US News 648 internationally. 3rd in Egypt, 15th in Africa. In Leiden ranking, we are 576. 2nd in Egypt, 8th in Africa. Simagu, we are 624th. 2nd in Egypt, this is for 2020. 7th in Africa and 21st in MENA, and so on, in the MENA region, Middle East and North Africa region. Of course, being listed in all these rankings means that we are in the top 3% of the world universities. We are seeking to jump more and more by all our working very hard all over the university. Of course, the difference in ranking between one organization and the other is due to the different methodology. Every organization focuses on a special point in a different percentage than the other organizations. Of course, we are seeking to promote our ranking through working on the research, on the number of our international students, by our reputation through our alumni everywhere. And as I told you in the first slide, how our offices are so much related to each other. Diversity is the art of thinking independently together. Thank you.
Thank you so much, our dear Professor Shahira, for this amazing presentation. We all indeed believe that Iraq is a great example of integration, empowerment, and complementarity. And all of us were indeed proud to be part of this and indeed proud of the achievements that we did during the past year. Continuing to the successful experiences, the next example is one of a kind and the first in the MENA region, presented by Ms. Ruku Bibi, who is a business development manager at the Royal Brompton and Harefield Hospitals, London. She qualified with a bachelor's in science and a master's in arts and has over 10 years of experiences in the healthcare sector. Ruku has been dedicated in ensuring expert knowledge and specialist care is shared around the world so that every patient has access to the best health care available, delivering these experiences through a strategic partnership between the Royal Brompton and Harefield Hospitals and Ain Shams University. Ms. Ruku, the floor is yours.
Thank you very much, Professor. I will just share my screen very quickly. I hope you can all see my screen. Good afternoon, everyone. My name is Ruku, and I am the Business Development Manager at the Royal Brompton and Harefield Hospitals. I'm so pleased and honoured to have been asked to speak with you all today. I hopefully will not be speaking for too long. I will firstly very briefly introduce the organisation I am representing here today and the incredible work we do. I will then talk through how a partnership between the Royal Brompton and Harefield Hospitals and Ain Shams University Hospitals came about and what impact COVID-19 has had on our collaboration. And finally, I will highlight how we hope to continue to move forward in our partnership and beyond. With our history spanning over 170 years, the Royal Brompton and Harefield Hospitals has a prestigious history like no other. Renowned globally for our extensive expertise, research breakthrough, and excellent standards of cardiovascular and respiratory care. As a specialist centre, we provide treatment for both adults and children with heart and lung disease. Our doctors, nurses, and other healthcare staff are experts in their chosen field, often at a specialty and subspecialty level, and many move to our hospitals from throughout the UK, Europe, and beyond, so they can develop their particular skills even further. We carry out some of the most complicated surgery and offer some of the most sophisticated treatment that is available anywhere in the world, and treat patients from all over the UK and around the globe. Our fetal cardiologists can perform scans at just 12 weeks when a baby's heart valve is just a millimeter in size, and our clinical teams regularly treat patients well into their 90s. Over the years, our experts have been responsible for several major medical breakthroughs, such as implanting the first coronary stent, founding the largest centre for cystic fibrosis in the UK, pioneering intricate heart surgery for newborn infants, and performing the first double successful heart and lung transplant in Britain, which was performed by none other than Egypt's very own Professor Sir Magdi Yacoub, as I'm sure you all know. We have a reputation for our numerous heart and lung research projects that bring benefits to patients in the form of new and more effective and efficient treatments for heart and lung disease. We are also responsible for medical advances taken up across our National Health Services and beyond. Each year, between 500 and 600 papers by researchers associated with our hospitals are published in peer-reviewed scientific journals such as The Lancet, New England Journal of Medicine. Our principal academic partner is the National Heart and Lung Institute at Imperial College London, although we also run additional research projects with other hospitals and universities in the UK and internationally, and we hope in the near future to develop some research projects with Ain Shams University. From our doctors and nurses to our imaging specialists, every member of our multidisciplinary team has dedicated themselves to a lifetime of advancement in their respective fields. We work with some of the brightest medical minds of our time, from developing new minimally invasive heart procedures to researching new therapies for previously untreatable lung diseases. Our specialists continue to push the boundaries of what is possible in medicine. We want every patient to access the best heart and lung care available wherever they are in the world. By sharing our knowledge, we want patients everywhere to receive the same standard of care as ours. Our specialists excel at training to the highest standards, whether it's to learn the latest surgical techniques or how to treat the most complex conditions. Healthcare professionals from around the world turn to us for training and guidance. So how did the partnership between both our organizations come about? What was the spark? The Royal Brompton and Harefield hospitals have been treating patients from Egypt for a number of years, with the numbers steadily growing. Following inquiries from a number of hospitals in Cairo, the Royal Brompton and Harefield undertook a scoping visit to the city, and one of the hospitals we visited was Ain Shams University. The image on the screen is at one of our first visits, and we stood outside the hospital and took a lovely picture with the team. So what did we do? So we met with the Ain Shams Administrative Board several times and discussed the opportunities between both hospitals. As we all know, Ain Shams is one of the oldest institutes in Africa, and much of your values and goals aligned with ours at the Royal Brompton and Harefield hospitals, and we both saw this as a long-term partnership. Following in-depth discussions with Ain Shams' leading cardiothoracic clinicians, together we identified a number of programs we would look to build, such as structural and congenital heart disease, major airway surgeries, and so on. We established aortic surgery would be the first project, as this was a priority for Ain Shams. In order to design the most feasible proposal, a team of 6 clinicians from our hospitals undertook a 2-day gap analysis visit, from which a program was designed. So how did we add value and what did we exactly undertake? So our first piece of work, the gap analysis, allowed us to evaluate the services and pathways as a whole at Ain Shams. Following the gap analysis, we are able to provide Ain Shams with a set of recommendations which needed to be implemented to attain your goals. This included recommendations on the patient pathways from diagnostics, perioperative, ITU, ward, and long-term follow-up to recommendations on equipment, supplies, audits, and outcome data collection. Next, we provided a 5-year implementation plan on how we would help Ain Shams deliver an aortic surgery service that will be feasible, achievable, and most importantly, sustainable. This included training 2 core clinical teams, as well as a comprehensive program to train ITU nurses. So what was the result? You may all recognize your president, Mahmoud Al-Matani, from the picture. So we managed to sign an agreement to deliver this program and to a long-term partnership, the first of its kind in Africa in 2020. So our teams, both at Brompton and Ain Shams, worked very hard over 5 months to create this first project. In terms of developing an aortic surgery service and upskilling critical care nurses. The project and the first team teaching visit were all due to commence in March 2020, which unfortunately, due to the outbreak of COVID-19, could not happen. So how did we keep up the enthusiasm, engagement, as well as continue to build our relationships in a meaningful and value-adding way? Firstly, we implemented joint multidisciplinary team meetings between Royal Brompton and Harefield and Ain Shams aortic surgery teams. Multidisciplinary team meetings, or MDTs more commonly known, is when different clinical groups such as surgeons, nurses, anaesthetists, therapists all come together to discuss and decide on a plan of action on how to treat a patient collectively. Using Microsoft Teams, our Ain Shams counterparts were able to join our Wednesday evening MDT and present cases as well as participate in discussions with our Royal Brompton team. This allowed us to strengthen the clinician-to-clinician relationships. The images, as you can see, was taken at the same time, one at Ain Shams and the other at the Royal Brompton Hospital. This is them undertaking one of the MDTs. Another way we kept up engagement throughout the pandemic was to set up a series of joint webinars where experts from the Royal Brompton and Harefield Hospitals and Aimshams presented on various topics. This allowed us to showcase our similar and different approaches to treatments and practice. We had over 1,000 people register their interests for the webinars and over 800 attendees over 5 webinars. And as you can see from some of the feedback we received, the webinars were a huge success. So despite travel restrictions, using multidisciplinary team meetings and webinars, we are able to sustain a strong connection with our partners at Aimshams. But what does the future hold? Both our organizations have a strong interest in sharing knowledge, and what COVID-19 has taught us is that we will need to ensure access to learning can be achieved and is readily available as possible to all. During this COVID period, our hospital has launched a new education site dedicated to sharing knowledge to ensuring training excellence is achieved. This one-stop shop will allow users to access events, talks, and courses all in one place. Our joint webinars with Aimshams to date will be housed on this site, and we hope to collaborate on more content in the near future, including our first joint aortic symposium, which we hope will take place very soon. We hope to develop new content and courses dedicated to our projects with Aimshams. Education has a significant potential to achieve both our and Aimshams University's vision of being a leading centre for cardiothoracic care by sharing our knowledge in order to help patients everywhere. Please go ahead and visit the website, register, and get in touch with any feedback, as well as if you would like to collaborate on any expert talks. So to conclude, the overarching aim of the strategic partnership between the Royal Brompton Hospitals and Aimshams University Hospitals is to promote training, clinical practice, and research to enhance and empower programs at Aimshams University Hospitals, with the first project specifically aimed to develop and deliver an exceptional and sustainable aortic service at Aimshams. Employing a multidisciplinary approach with clinical care, education, and research excellence at its core, the Royal Brompton and Harefield team will continue to work with our partners at Aimshams to develop a world-class cardiac service at their hospitals. Despite the ongoing intrusion of COVID-19, both Aimshams and the Royal Brompton Hospitals are dedicated to building a strong, lasting partnership between both organizations. And I just want to take this opportunity to thank the teams at Aimshams for really making the Brompton team feel at home and a part of the Aimshams University family, and vice versa. We very much see Aimshams University as an extended arm of our hospitals. So we really look forward to coming and visiting again with our teams and starting the project in full force. Thank you again for having me speak with you this afternoon. Please feel free to contact me, add me on LinkedIn if you're interested in finding out more about the partnership and the work that we do. Professor Noha, over to you. Thank you very much.
Thank you so much. I'm actually happy that almost all of us rendered COVID as an opportunity rather than a challenge. And I echo what you said, that needs analysis in order to bring these gaps is crucial for successful partnerships. Thank you so much for the amazing presentation. And now moving on to the next presentation, which highlights a successful partnership between Aimshams University and University of East London in engineering double degree. Our next speaker is Mr. Sinwi Lee, Head of Partnerships and Senior Lecturer at University of East London. Mr. Sinwi's expertise include artificial intelligence, intelligent data analysis, green IT, and innovative higher education technologies. Over to you, Mr. Lee.
Thanks very much, everyone, and thank you for inviting me for today's conference. Just to a brief introductions, I'm Sinwi Lee, Head of Partnership for the School of Architecture, Engineering, and Computing. For those that are not familiar with University of East London, the university was established in 1892 as a technical institution and become a university in 1992. So as a so-called People's University, University of East London provide open access to the university or higher educations to local. So most of our students that attend our courses on campus are first generations that go into higher education. So due to this vision of open access to international to education, UEL has been very active in terms of partnerships, international partnership, especially since 1980s. So the model that we emphasize in terms of the type of partnership we have is that we have different models to suit different countries, different markets, and different demand from the partners institutions. The model that we have in terms of partnership are, for example, articulations, whereby the students that study on partner institutions after completing several years can transfer to UEL to continue the studies and able to gain a UEL degree, or as well as their local degree if they want to. We also have validated model whereby based on the partner's demand, the university and the partners can design and develop partnerships in the sense that the courses that deliver on the partners will belongs to the partners itself, but the awarding body will be UEL. And finally, comes to ANSHAM. The partnership between UEL and ANSHAM was established a couple of years ago under the dual award model, in the sense that whereby the students do not need to have additional burden in terms of their studies. What we did is basically make use of ANSHAM's curriculums in terms of their modules, in terms of their contents, and develop a UEL program around that curriculums. So in the sense that the students will study ANSHAM's program as usual, doing their assessment as usual, but at the end of the day, the assessment will be judged and quality assured by UEL, and at the end of the day, the students will gain ANSHAM's degree as well as a UEL degree. Looking at the number of programs that we have in ANSHAM in terms of engineering as well as computing. At the moment, I believe that we have around 10 courses or 10 programs with ANSHAM's engineering department of school and 5 programs in the computing. So in total will be 15 courses. I believe, if I'm not mistaken, next Monday we'll be looking at another 4, which will make it to be 19 in the next year. So what the main reason why UEL are keen in terms of providing partnership is that, first of all, the vision of UEL is to provide everyone an open access to UK qualifications. Not only that it allows the students to be able to have transnational educations, in the sense that the students will be able to study locally and transfer to the UK institutions after a couple of years, or even come to UEL to study for a year or term and credit transfer back to ANSHAM. So in terms of the coverage of the partnership of UEL, ANSHAM is one of our main partners, especially in Egypt, which is one of the largest as well in the university. And we also have different partnerships in Greece, in Malaysia, which is with a university called Mahasa University, which is a medical university, whereby we also have a dual award we've done on the nursing, our nursing degree, as well as in biomedical science. So in the sense that students that study in the medical university will gain a degree as well as a UK degree alongside with their degree itself. So overall, the university itself is one of the top university in terms of the transnational educations in the UK. So as part of the university strategy, at the moment, the university is currently top 20 of the UK university in terms of transnational. And in the next couple of years, we are envisioned to be one of the top 10, whereby we will increase our portfolio in terms of our international partnerships and local partnerships. In the sense that by looking at the current situations and in terms of pandemic, I think international partnerships and will open doors to provide more opportunities for students to gain a UK education or UK qualifications through partnership itself. A very simple example is that we in UEL, due to the pandemic, we got quite a lot of students that are unable to come to UK due to the visa or travel restrictions. They are able to study locally in our UEL partners until the situation become better and transfer to UEL for that. In that sense, that it allows the students to have a continuous studies as well as provide other students the opportunity to gain UK educations without necessarily the course that need to be included in that. Furthermore, in terms of international partnership, University of East London now, due to the pandemic, have started establish partnerships in terms of online delivery as well as do delivery, so enables that the partners to deliver part of the program online as well as on campus. So overall, these are the strategies and the partnership model available in UEL. The purpose of today is basically give you introductions on UEL's partnership model as well as our vision in terms of partnerships. So I do open with any questions that anyone would like to ask me regarding to partnerships, as well as any possibilities in terms of how a partnership can be established with a UK university, not only UEL, but any UK university. Thank you very much.
Thank you so much. Hello, everyone. I am Sharif El-Sagini, a Vice Director at the International Relations Office in Iraq sector, and I am honored to be the moderator for the next hour. When we talk about international prospects, we must emphasize the chances of funding opportunities that is offered by a variety of international funding agencies. Fulbright is one of the most renowned ones. Opportunities to study and conduct research in the US through Fulbright will be presented by our next speaker. Dr. Maggie Nassif is the Executive Director of the Binational Fulbright Commission in Egypt since 2014. She has extensive work experience in the US and MENA region, countries such as Egypt, Morocco, Jordan, and the UAE. Dr. Maggie, the floor is yours.
Thank you very much for the generous introduction. It's an honor to be here, and we indeed enjoy a very good working relationship with the Ain Shams University, starting from Dr. Multini, the president, to the VPs, to the deans, to the vice deans and chairs and faculty and students. We're very grateful to be given this opportunity and to have this partnership, real partnership with Ain Shams University. If you allow us, we'd like to share the screen. I am here with my colleague May Ayed. I will start with a brief introduction and we'll talk about opportunities for us to bring American scholars and students to Egypt, and Mai will talk about opportunities for Egyptian graduate students, scholars, and professionals to go and train in the US. Fulbright has been in Egypt since 1949. We celebrated our 70th anniversary a couple of years ago. Over the last years, we have over 7,000 alumni, both Egyptian and American students, scholars, and professionals. We are supported by generous grants from the US Department of State and the government of Egypt. And we have a binational board of directors that represent the two governments, both academias and professional lives. Briefly, we have grants for American graduate students, scholars, and specialists. Specialists are short-term experts who come to Egypt to study, to teach, to conduct research, to receive training. And it's really a wonderful pipeline of knowledge that has produced a lot of useful knowledge for both countries. We are a program that is both about academic excellence and cultural exchange. And so we make sure that the programs have these components. Just to give a quick overview of the US Scholar Program, these are opportunities for Egyptian universities and research centers to host American faculty, independent scholars to come and teach and conduct research, and it's usually 1 to 2 semesters. The US Specialist, on the other hand, is a program that the application is initiated by the host institution, and actually Ain Shams hosted a specialist last year. He was an English language expert who came and spent 6 weeks with Ain Shams faculty and help develop curricula and do professional development. And Shams also has another application for next year with the medical school to develop the basic sciences with the faculty there. And it's really a wonderful opportunity. We work with universities, we work with ministries, we work with the public and private sector to place American experts for very short 2 to 6 week periods to provide training and expertise. With this, we move to grants for Egyptian students, scholars, and professionals to go and study and receive training in the US. And I would like to introduce my colleague, Maya Ayel, who is the program officer, and will talk about these opportunities.
Thank you very much. Thank you very much for this opportunity. We actually have a very diverse portfolio for Egyptians to study and conduct research and receive professional training in the US. We have a master's program, we have a postdoctoral program, and some professional programs in diverse fields. But first, we would like to speak to you about the Humphrey Fellowship. This is among our most important programs. It's a very prestigious fellowship that is available in 16 fields, and among these fields are public health and contagious diseases and substance abuse, as well as a field for higher education administration that is catered to developing the higher education system at diverse institutions and at the university level, including graduate studies. So it is very relevant to everyone who is attending now the session and to the general professionals who work in the higher education sector and who hold positions, managerial and administrative positions. And so the program is a one-year fellowship that allows them to go to the US and study, audit graduate courses at a leading US university, but at the same time, they have available an opportunity to participate in different professional activities, like workshops, seminars, conferences, meetings with experts in their fields, and finally an internship that is at least 6 weeks at a US institution in their field, in which they can participate and work firsthand and gain the experience of the professional experience of being in their field in the US. It is open for university graduates. People need to have at least a first university degree and 5 years of professional experience. And we do require a proof of English language proficiency that people can obtain from the English Language Center at Ain Shams University. The program is currently open and the deadline for application is July 3. So we really encourage you to take a look at this program. It is catered for different fields and different professionals at different stages of their career. We also have the master's grant, which is also one of our biggest programs. It's a fully funded master's degree in the US in all fields, and this is what makes this program in specific very relevant, is because it really does cater to all fields. We only have just a small regulation in terms of the medical field, as that it does not allow for clinical studies, but all the other programs are available, and people from do go on this grant, and they do obtain a master's degree, a full degree from the US. Also, the application is now open for this program, and we do, of course, the person applying needs to have already graduated with a strong academic record, and also submit a proof of English language proficiency from Ain Shams University. Now the program is accepting applications, and the deadline for submitting one is June 5. Under the umbrella of the student program, we have the Visiting Student Researcher Grant, which is a program that is available for doctoral candidates who are registered in programs at universities in Egypt. So, for example, PhD students at Ain Shams University in all fields can apply to go to the US for 6 to 9 months and conduct data collection in their diverse field, depending on the subject of their PhD dissertation, and then come back to graduate from their university here in Egypt. The program is also accepting applications now, and you only need to have a proof of enrollment at an Egyptian institution and submit an application, and the deadline for applying is also June 5. We have another program that is available for faculty members at Egyptian universities and researchers at research institutes to conduct research at a US institution for 3 to 9 months. And this is a program for conducting research. So we're targeting scholars who are interested in a specific research that needs maybe more access to certain labs or technology or material, and then they would go to the US for 3 to 9 months to conduct their research, and then return with the results of their findings, and then contribute to developing this project later at their home institution and share the results with their colleagues and the benefits of the home institution, to the benefit of the home institution. And this program is open for faculty members. So faculty members at Ain Shams who are already PhD holders from all fields can apply to this program to conduct research in the US. And the application is now open. And this one, actually, we're accepting applications until the 28th of August. So there is still some time to develop a research proposal and to submit an application. And for all these programs, we are holding information sessions that talk about the details of each program and the application. And we go through the entire application process and fill an online application together, just to show people what they need to go through to submit an application. We have contact information for all these programs, and we are really happy to accept your inquiries and answer any questions that you might have about any of the programs. we thank you very much for allowing us to introduce our programs to you, and we look forward to receiving any questions that you might have.
Thanks very much. Thanks. Thanks for the opportunity.
Thank you, Dr. Thank you so much, Dr. Maggie. So we have been hearing some amazing presentations from our partners and counterparts of these collaborations. Now let's hear from the other side of the coin, from those who get involved as the targeted ends of these collaborations, the students and staff. Studying abroad increases the understanding of other cultures, as well as improve language skills and broaden their social horizons. Our next speaker, Chanda Sa, who is a fifth-year medical student originally from Nepal, will tell us about his experience and what it feels like studying medicine at ASU. Chanda, the floor is yours. I'm sorry, Chanda, your mic is muted.
I'm so sorry. Thank you, Dr. Sharif. It's absolutely been an honor to listening to such great minds here, and it's been a learning experience for me. And honestly, I'm very delighted to have a say in the company of such amazing minds and best people in their field, and hopefully some future best. Introducing myself, I'm Chandan Sa from Nepal, and currently I'm an undergrad student in the 5th year medical student at University of Anshams Faculty of Medicine. And what I'll be doing today is I'll be addressing a few questions. Rather than saying in my experience, I'll be addressing a few questions that every international students think about or are asked when they are here. And I'll be adding some experiences of my own so that it almost answers what their mind is up to. So my first contact with Anshams Universities date back to 2016, when I was a fresh high school graduate, and I wanted to be enrolled in a medical student, and I applied here after a lot of thoughts. So the primary questions that I'm asked about almost wherever I go, that why did you choose Anshams? Why did you choose even Egypt? Why not any other places? So actually there are a lot of factors that led me to becoming part of this prestigious university. And frankly, it was an adventurous move because I didn't have any first-hand experience of any other country than my own. And me, along with my few friends, were the first batch in Anshams, actually. There has not been anyone from Nepal in Anshams. There has been in other universities in Egypt, but not in Anshams. So it was actually, we didn't know much about it, but it was more of, let's go find out what's it all about. And I can say after 4.5 years that it actually had paid off, because I don't regret at all getting in this university. And I actually am very happy that I chose this university. So the things that drove me to choosing this university are the quality of education here, the services for international students, which is growing by year, like the services they provide for international students. And when I was a first year student, and when I see now, it has taken huge leaps. And also the consistent rankings of the faculty here. Like it has always performed, mainly the medicine sector has performed well over the years. And coming to the first instance of me being in Cairo, it was 14th October 2016. And I still vividly remember because we landed here at night. And we had preconceived images of Cairo. It's in Africa. It might be desert. There will not be water. There won't be much infrastructure. But to my surprise, and a good surprise, it was totally different. Because when we walked from airport to our colleagues' accommodation, it was like all tall buildings, a lot of cars, cool breeze, and obviously the famous Nile is there. So also some questions that many students might have, like how is the culture here? How's the weather? How's the food? Is the study good or not? How are the people here? And how's the faculty? How's the infrastructure? And I'll be addressing my experience in terms of that. So in terms of my experience, I might just run out of words, and this session might not be enough to cover all my experiences here. But everything in this world gives you an experience of life, and it depends on how you take that experience forward and you execute and implement in your future events. So Ain Shams University not only has encouraged me to academically be strong, but also be a better person in terms of thinking, in terms of being more humble. And my initial days at faculty were really challenging, actually, because we're the first one to be here, non-Arabic speakers, didn't know the system much about here, didn't know where to go, whom to contact. So actually we faced initially the problems that any international student would face. So the transition was initially difficult, but the better thing was that the faculty was such cooperative, and really it made us, me and my friends, transition very smooth here. And once I get settled, my days began to be much smoother. And I have learned a lot. I have gained a lot from being here. And when I look back right now, I wish I had that fun again, to learn new things every day, to be like nuance again. It's more fun. And some questions also, my relatives ask me about, like, what's there other than medicine? Study is good, okay, but what is there other than medicine? So actually, there are very amazing places to be visiting here, be it the sea, be it the heritage. So Nile is, Egypt is not like a country that just happened to be on the map a few years back. It has a long, rich history of itself, and you can see it on the monuments, on the pyramids, or very anciently. So actually, it's a mixture of new technology and taking your ancient learnings with you, preserving them, and also being more globalized right now. So I have been to many places with my friends here, be it the Red Sea area, and also there was a trip from the faculty itself last year to pyramids, which was a very good learning experience to gel with new people. And so concluding myself, what I think about the best thing being at Ain Shams is there are many factors, but in the faculty, I think the professor, the teachers are the best thing that led me to still being stuck here, to want to be more, spend more time with here. And Dr. Sharif here, our moderator, I have been to his classes, and it was, we always looked forward to being attending his classes because it was such fun. He was such, he taught us in such funny way and interesting way that we always wanted to have more classes of him. And apart from study is a part of, obviously, is an important part for a student life. But more than that, the student activities here, the model of different organizations here, taking a name like Ain Shams model of the World Health Organization, I was a part of that. And the charity events here, the research program here, it actually develops a student overall, not just academically, but you might need more thing in future, and it covers almost all of them. So for anyone who's looking to choose Ain Shams University in future, I would like to message them like what I felt in last 4.5 years, that Ain Shams is not only one of the top universities in Egypt, but it will give you a perfect balance between international exposure and homely atmosphere. Like, I have not felt homesick in last 4 years. So, and perhaps I couldn't put that in better words. And where we are all certain in this time about the future of our study with all this corona pandemic, the university has actually for very early taken the decision for hybrid study. So we didn't lose much time, and still we are continuing our study in a very good way. And it's a bit difficult to adapt in a new system, but it's also good for our future learning. So from where I started at the faculty in 2016, I actually have seen the faculty progress in building more good infrastructures, improve their ranking, and address many problems that we face that the future students might not face. So making their transition smoother, and I'm very happy to be speaking, and I'll be very happy to address any queries that any students here have. Thank you, Dr. Sharif. Over to you.
Thank you, Chanda. Well, having the honor of studying and working in the Faculty of Medicine ASU myself, I've actually never viewed it this way. It's amazing to hear experiences from different students. We would like to skip now, and we would like to start hearing from ASU staff who had the opportunity to travel to many universities for exchange of expertise and circulation of culture and ideas, and for enriching their personal development and creating a global perspective. We move to the final speaker, Dr. Sarah Benjamin, lecturer in the Department of Korean Language, Faculty of Elson, ASU, who studied her PhD in Korea, and she will tell us about her experience there. Dr. Sarah, floor is yours.
Thank you, Dr. Sharif. I'm going to talk today about my experience in Korea. Please allow me to share my screen first. Okay. So when I first was asked to talk about my experience there, there's a lot to put into this presentation. It was very challenging to sum up the experience of 9 years into a presentation of 10 minutes, but I will try to include the highlights of my experience there. So first of all, Korea is on the other side of the world, literally, with a time difference of 7 hours. So it was very challenging to study there. I first traveled as an exchange student for 1 semester in 2008. That was 13 years ago. And after that, I traveled in 2011 to study for my master's and PhD, and then I returned in 2019. So let me first talk about Korea. Korea in 2008, 2011, and 2019 is entirely different. Every stage has its own color. In 2008, there was nothing special about it except that it was the country where I can study Korean since I majored Korean in undergrad. And there wasn't much technology, not the world we're living in right now with high-speed internet and smartphones. That wasn't there, so it was very challenging. But later on in 2011, when I traveled there for my master's degree, Korea started this K-branding as a way of creating a soft power. As you know, soft power relies heavily on culture, knowledge, and policy. And so they created their brand in various fields. In K-Sports, they hosted the Winter Olympics in 2018, excuse me. And their K-pop, BTS is roaming the world and getting nominated for Grammys, K-dramas and K-movies, where they reached the Oscars and received various Oscar awards. And then K-beauty, K-medicine, they have several leading hospitals in medicine, and they are encouraging medical tourism in that area, and K-education and K-knowledge, of course, with their leading universities. I'm going to talk about that. But the important thing we need to focus on here is that Korea doesn't have many resources. They don't have fuel, they don't have gas. They rely heavily on their soft power, and they have to import everything in order to build their Korean economy and Korean politics. So nowadays, it's not just about Samsung or LG or Kia, Hyundai. It's not about that. It's way stronger than that in other fields. So moving on to universities, it's worth mentioning that most of the top Korean universities are ranked among the top 100 universities in the World University Ranking. Seoul National University is always #1 in Korea and 37th in the World University Ranking. I had the privilege of studying there for my master's and PhD. There are other schools that are very, very good and strong in their academics, like KAIST for Science and Technology, here number 2, and Korean University and Yonsei. These are like the sky universities. Everybody's trying to get there, but with Seoul National University, since it's the only national university there, the others are all private universities, it's very competitive to enter the university. I'm going also to discuss that later. So before going to Korea, the first thing one needs to get is a scholarship, because it's very, very expensive to live there. So from my experience, I'm going just to focus on 3 types of governmental scholarships that cover everything to make studying there easier. The first one, and it's the most popular worldwide, is the KGSP. Here, number 1. This scholarship is provided for undergraduates and graduates, also research, but that's not applied in Egypt yet. We're working on that. With this scholarship, you can apply for any field you want, medicine, engineering, etc. And more specific scholarships are restricted to Korean language and culture, also provided by the Korean government among the Global Korean Scholarship Program. Is the African and Latin American studying program during summer, and a support program for exchange students who cannot afford their university tuition fees or life expenses. They provide like a part of it. The second part, this is a non-profitable organization, Korean Overseas Volunteer Organization. The KOICA scholarship provides only master's degrees for preferably socioeconomic development, health, and technology. And the final one is the Ministry of Culture, Sports, and Tourism. This one provides 2 types of scholarship, the AMA undergraduate program and MPhET for professionals and exchange professors. So moving on to the next section, I will be talking about my living experience in Korea from 2011 to 2019. First of all, the life in Seoul is highly dynamic, extremely fast, and quite developed. Now, I saw this gradually develop between 2011 and 2019. First, when I arrived there, Koreans moved extremely fast, that they are currently trying to make Korean people slow down a little bit for their health and well-being. And everybody has to keep up with that. Otherwise, you're going to be pushed, especially during transportation. Their transportation system is very advanced to cope with this speed life. This one here is the subway map for Seoul alone. There's a similar map for each city around Korea, South Korea. And the subway schedule is extremely timed. It's extremely accurate. If the subway is coming at 2, it's coming at 2, not a second later. And every 1 or 2 minutes, there's a subway coming in. And what you see here in this picture is not a crowd of people. It's lines waiting for the buses, transfer buses. Each line represents 1 bus. And this doesn't take long. It takes about 2 minutes or 3 minutes to have all of these passengers get on their bus and have their way. So even though it looks crowded, it's very organized, it's very quick. On this side, like this machine is seen everywhere. So this works as like transportation way, like to pay for transportation with a transportation card. It can be used also with the phones, with the credit cards. Everything is paid electronically and magnetically. And above all of that, Korea is extremely safe. That's what encouraged my parents to let me travel at a young age, 13 years ago. And one challenge is the language barrier, because Koreans do not speak English. And everything there is written in Korean. So if you travel there knowing how to speak Korean, that's fine. But if you cannot speak Korean, that's going to be challenging, and eventually you're going to have to learn the language. So you have to keep that in mind. Speaking of the culture, during my stay there, I got the opportunity to attend lots of cultural events and to visit lots of cultural sites. It's part of studying there. They promote their culture. They have lots of museums, and they are keeping up with the Western society. So there's the MoMA Museum. They change their exhibitions every month. So people keep on visiting there. They have their national museum for their national heritage. They have Korean folk dances. They have top artists coming to perform at top concert halls in Seoul, and they are encouraging contemporary art. Moving on to food. Food is a very, very important part of the culture because that's the time when Koreans bond together. During working hours, they don't speak, they just work like machines. But during lunchtime, which is between 12 and 1, and dinner time between 5 and 7, people bond together. They can hold business meetings or like after dinner with company members or work colleagues. So they have, their cuisine is quite different from what we have here in the Mediterranean area. They have lots of types of food, but mainly they are all spicy by default. So if you're going to visit there, you have to ask for non-spicy food. It's very challenging, but right now they are promoting their food, and there are lots of Korean restaurants all over the world. They are trying to create the K-food culture. And moving on to my experience at SNU, the picture you see here is the campus. It's in the middle of the mountain. And in order to move around campus, you need a bus. It's hard to walk around on foot. So in 2011, when I first arrived there, I didn't know that. So I would follow the map and expect that I'm going to reach there fast, but I find myself walking for hours and reaching nothing until I found out about the shuttle bus and how to move around campus. It was very challenging at first. And because it's in the middle of the mountains in Seoul, but like surrounded by mountains, they created like a university village with everything that we might need to survive there. So we have sports centers, we have supermarkets, we have libraries, restaurants, everything is there, even a pharmacy and a hospital for us. But med school is not located there. Med school is in the middle of the city, northern of Seoul. This is southern Seoul. So during my life there, it was very challenging. There are many, many credits one needs to cover. And if you study there for master's and PhD, you cannot repeat the courses you studied. They focus on interdisciplinary research intensively. So even though I was studying linguistics, I was asked to explore other fields and come up with ideas to mix between my major and other fields. And what surprised me at the beginning when I arrived there is that you know, the voice recognition device on Samsung phones, this was developed in our department. And later on, it kept on developing. Any upgrades were asked. Graduates of this department work for Google, work for Naver, like the big companies with the linguistic sector, like NLM, NLP, natural language processing, and like voice recognition, etc. So there's lots of interdisciplinarity there. Also, well, being a phonetician, I majored Korean phonetics. So being a phonetician, we were asked several times to work with forensic linguistics. So we would work for the police department, for court, for governmental institution. And me personally, as a graduate of ALSO, at Ain Shams University, I was asked to interpret most of the time between Arabic and Korean, and sometimes English and Korean. And what happened during these 9 years is that we got Ain Shams University to be enrolled among the universities and departments that are specialized in translation, especially for Korean and Arabic. So whenever they need an interpreter, they would ask for graduates of ALSO at Ain Shams University. Also, it doesn't stop here. Studying there does not mean that we're going to fully study. We have to do, to teach undergraduate courses, be in charge of labs, go on field trips to do experiments around Korea and other parts. So it was very intensive, and like it's hard to sum up all the experience here. To do that and to conduct research, we need a library, and there they have one of the biggest libraries in Seoul, this one here in the picture. These are 2 buildings full of books, and their books are provided in Korean. So all books for all majors in every single language, you have the original copy alongside with the Korean version of it, so that if someone cannot speak any language other than Korean, they can still access resources, whether textbooks or research, etc. And also, it's not strictly concerned with books only. There are also labs and computers provided for everyone, a place to rest, meeting rooms and restaurants, so that one can spend the entire day studying there and not needing to go out of the library. So it was a huge studying place. Also, a very important part of graduate school is conferences. We were asked weekly to join colloquiums where they invite international speakers from various universities like UCLA and UCL, MIT. They will come and give us special lectures every week. And we had lots of international conferences for all fields of linguistics and interdisciplinary research. I got the opportunity to participate in several ones, but the one that is close to my heart is in 2018 with the Korean Society of Speech Sciences. I happened to achieve an award there of excellence for my theory, the one that I was developing for my PhD research. And yeah, I received the award, and it was a great honor to do that. It was very challenging and hard to get. So this one is close to my heart. And other than that, everybody is required to participate in some sort of volunteer work. I happen to participate in a lot of volunteering, but the one that I like the most is the one here. I volunteered in Rafael Hospital. This one, it was opened for foreigners who not have insurance or don't have insurance providers, because it's very expensive to receive medicine and treatment in Korea without insurance.